Today, for the first time, passengers started evacuating the cruise ship at the center of the deadly hantavirus outbreak, which has killed at least 3 people on board. The ship docked in the Canary Islands earlier, where a medical tent was in place to receive passengers in what's expected to be a 2-day process. They'll then be flown back to their home countries on charter flights. The French Prime Minister said one of the 5 French passengers exhibited symptoms on their repatriation flight. We're also learning that the 17 Americans on board will be observed at a medical center in Nebraska. And amid concerns of a continuing spread, Trump officials and health experts this morning worked to quell fears we could be heading into another COVID situation.
The key message I want to send to your audience is that this is not COVID. This is not going to lead to the kind of outbreak.
I do understand that this is not a respiratory disease, meaning it's very difficult, if impossible, to pass through coughing or breathing. It's very rare to see it transmitted between humans.
And joining us now is Joseph Allen, professor of exposure assessment science at Harvard University. Joseph, thank you so much for joining us this evening. You had the chance to speak with a doctor who was on that ship. I'm wondering if you can bring us into that conversation and what it helped you understand about the transmission of this disease.
Yeah, sure. And thanks for having me on. And let me just take a step back and say why I contacted this doctor and why we spoke. I've seen a lot of the official messaging come out, and some of the messaging I just heard there is incorrect, and I can talk about this in a minute. But the messaging I've heard from CDC and others is that this requires prolonged close contact. Now, when I go read the literature about prior outbreaks of this virus, not on a ship, it is very clear we've had transmission that happened very rapidly and did not require close contact. So I wanted to kind of double check myself. So I reached out to this doctor. We were on a Pro TV program earlier in the week together, and I asked him, what is actually happening on the ship, and where am I off, or where are other people off in this messaging? And he confirmed to me something really important, and that's messaging has not broken through. This is what he experienced as he related to me. Yes, as the first patients were sick and being treated, there was close contact with the treating physician on board and several other staff who were helping that person. Those people got sick. In fact, the ship's doctor got removed from the ship. This other passenger, who happened to be a doctor, then stepped in to start to treat patients. As he relayed to me, the other people who got sick after that, many who had been removed from the hospital, did not have what he called close contact. They shared time in the dining room or in the lecture room on this ship, but they were not in close physical contact. So I find the official messaging contradicted by what we know from previous outbreaks and is published in the literature, and what I was told about the experience on the ship.
So what do you think is the most important thing right now that the American public should know about what it is that you have learned and what is being said in the literature or what has been written about the literature that is not being communicated, or you might feel like it's not being communicated sufficiently by health officials in this country?
Yeah, so I do think the overall threat to the general public is low, but I do think the public deserves to know what the science is about how this is transmitted, because we need to know how to keep people safe and also know who we should contact trace. From that earlier outbreak, which was on land, it's presented in the New England Journal of Medicine. The first set of human-to-human transmission with this exact virus happened at a birthday party. And at that birthday party, which was only 90 minutes, there are reports where one person transmitted to another where they did not have any physical contact and, in fact, simply said hello to each other in passing. Now, that doesn't sound like prolonged close contact to me. In fact, it's not. There were also people who sat at different tables at that birthday party and got sick. One man at that party who got sick eventually died, passed it to his wife. At his funeral, she transmitted it to 10 other people. So I think we've been underplaying exactly how this is spread, that you need some prolonged close or physical contact, when in fact the evidence suggests it can be transmitted by people who aren't in close contact, and in fact it can happen rather rapidly. So I don't think that's been communicated to the public, and this is really important for the people who are going to be quarantined right now, because we have to give them the message that it's not just this intense contact where transmission can occur. We don't want secondary transmission to other people in their house. And they have to recognize that that can mean if you're in the same room, you still need to be taking precautions. And it's not just this super close contact for extended periods of time.
Why do you think it is that the message that has been coming out of our public health officials has been one that emphasizes close physical contact, given your read of the literature, given your understanding of what happened on that ship? Is it that people are not up to date with their understanding of the science here, about what scientists know, I should say? Is it about, trying to create a sense of calm or to depress panic? What do you think is going on here, and how would you counsel public officials to change their messaging?
Yeah, I'm not sure the motivations, but some of it is to try to reassure people, which I think is fair. This is not going to be a COVID blow up, but some of the messaging I heard before I got on there from the government officials that this is impossible to pass, that it's really difficult to pass. The literature is very clear that that's simply not the case. I have to be honest, I do forensic investigations like this frequently. And when I first started hearing this message of you need prolonged close contact, I thought, okay, there's probably a good scientific basis for this. I went and read the best paper on transmission of this virus. I was expecting to find that statement supported by the paper. And in fact, it's not at all supported by the paper. And the things I just shared with you, this scientific paper shows that, in fact, you don't need prolonged periods of time and you don't need close contact. So I've been harping on this on social media, and whoever I can get this message to, that the official messaging is contradicting what we know in the science. We know very little actually about the spread of the Andes strain. We have 1 or 2 studies. We have this event happening on the ship. I just think it's smart to be a little more cautious about our messaging to the public and making it seem like it's so incredibly hard to transmit. We all have a collective interest in making sure that these people are safe and cared for, and that we don't have ongoing secondary transmission. To prevent that secondary transmission requires telling the public how it is transmitted, so that they can take the appropriate precautions and not be misled about what may happen in their home if they go back for quarantine.
So, Joseph, that's actually petrifying that your interpretation and reading of the literature does contrast with the official messaging and guidance that we're getting from our public health officials. I guess just big picture, because COVID is the marker for everyone when it comes to how we think about a pandemic. How would you compare this to COVID and transmission? And then as a second part of that question, you're an expert in closed spaces, and our physical spaces, have they improved since COVID when it comes to how we're going to approach a possible pandemic?
Yes, they're really good questions. I think the overall threat to the general public is low. That said, I just think we have to be diligent. The system is working the way it should if and when we're getting people the right information. Look, we were lucky this happened on a cruise ship because it's largely contained. We're being careful about how we transport these next set of passengers, and we'll stay on top of them in terms of the contact tracing and active surveillance to be sure we don't have this secondary transmission. So I think the general risk for the public is low, but it doesn't mean we shouldn't be vigilant, especially the people who are going into quarantine. And this is where the building factors come into play. If it is spread, like I think the evidence suggests, through the air, not just close contact, well, then that means the building matters. Then we have to pay attention to things we paid attention to during COVID, which is good ventilation and good filtration. Most homes, most offices, most schools don't have really good ventilation or filtration, so they can need to be improved. And let me just catch myself there too. I don't think this is going to be an issue for schools. I don't think it's going to be an issue for offices. I'm talking just about the extra precautions people should take, in particular the people who are going to be quarantined right now, so they don't get someone sick in their household, and then these secondary transmission chains continue. We have to put an end to the secondary transmission.
All right, Harvard professor Joseph Allen, thank you so much. Really appreciate you joining us tonight and help us make sense of what is going on. Thank you.